Hi, I'm Nathan. I'm your nurse for the day. We're going to be going over some colostomy care. So, what exactly is an ostomy? So, an ostomy is a surgically open area on the abdominal wall um, from where, the inside of an organ is brought to the outside of the body. In this case, with a colostomy, that means part of the colon was brought to the outside of the body, so that way it creates an exit for stool and feces. Typically, you're going to see these in people who have had some type of bowel cancer, or they've had a bowel resection, um, when they've had a part of their colon removed.
Oh, okay, yeah. I really need to learn how to do this for myself, so thank you for taking the time to teach
So
me.
we're gonna go over some of the issues that you might run into when you're doing the colostomy care. Um, so some issues that patients often run into are things such as skin problems. If they have any skin breakdown in and or around the stoma, that's going to cause some issues, especially when you have to put the adhesive on there. It might make that worse. So you want to make sure that that's getting properly cleaned. Other things they might have is, if they have any issues, with their hands, or any of their upper extremities, and they're not able to put it on themselves, or if they have like any visual deficits and they can't see it to put it on, then that would end up being a problem as well.
Oh, okay. Well, luckily I don't have any of those issues, so I think I should be okay.
All right, well, in that case, I'm sure you won't have any problem being able to do this. So let's go ahead and get started on what we're going to be doing.
All right, man, sounds good.
All right, so the first thing that we're going to want to do when we start this is we're going to want to go ahead and wash our hands and then put on some gloves so we're not contaminating our hands, and it's just not going to make a mess if we do that. You want to go ahead and inspect the stoma. Make sure there's not, any excess, reddening, or if it's pale, that could indicate anemia, or if it's like really dark blue or purple, that could mean that there's poor blood supply, and there could, potentially be problems with that. You want to go ahead and change out the entire system when, or after probably like 3 to 7 days is what's recommended to change it out. So we're going to start out after we've done our hand hygiene. You want to just get like a towel, and you want to kind of put it around the area that you're going to be applying it. So just kind of like spread it out and around like that. And then to wash it, you want to use a washcloth that's soaked with warm water, and you're going to wet it, and you're going to kind of wash like around, kind of like you would with a wound. And then once you're finished washing it, you want to pat dry it. And then you want to wash the stoma and make sure you get that cleaned out so you can prevent infection. And then go ahead and pat dry that as well. And you want to do that because the stoma is already probably going to be moist. And it's an internal part of the body protruding out, and it's really easy to cause bleeding if you're too rough with the drying aspect of it. You want to make sure that you're doing proper skincare around the stoma so it doesn't lead to skin breakdown or other infections. Feces leaking out of the bag too will also cause a lot of skin breakdown. So anytime you are emptying out just the bag, you want to make sure that it's not getting splattered or leaking out onto the skin, because it will start to cause skin breakdown fairly quickly. If the skin is too moist too, then it can also cause things like yeast infections as well. And, those damp conditions will be really good for, harboring an infection. So you want to make sure that when you're drying off the area too, you get it thoroughly dried.
just to pat dry so you're not tearing any of the skin or anything, but get it thoroughly dry so that it's going to prevent infection. Now, a lot of the time with colostomies, when you get out the adhesive patch, it'll have like a measuring area on the bag where it'll be pre-marked with how many millimeters the wound is. And it'll also come usually in the box with like a card that has like sizings on it, almost like you would see with like a ring or something. But you use the sizing card to figure out how big the stoma is, and then that's where you're gonna cut to on this thing. You're gonna start from the middle, cut straight out, and then cut the circle of how big you're gonna need to do that. I don't have that on here. There's no markings on that, so we can just basically go ahead and eyeball that. Okay, so now we have our adhesive cut out for the stoma, and you want to get a pair of scissors that's specialized for cutting these. Otherwise, if you use a regular pair of scissors or something else, you're going to end up with kind of these jagged edges on it. And so we've got that cut out. And so since this is a two-piece colostomy kit, we want to make sure that the bag is clamped, and we want to go ahead and attach that to the adhesive. And press it down all the way around. You can kind of test to see if it's on right by tugging on it. And then there's like a cover on the adhesive. You can go ahead and take that off. And then you're going to place that over the stoma and make sure that all the edges are completely sealed so it's not going to leak out gas or any of the fluid contents that come out into the bag. Once you do all that and you make sure that everything is on correctly, you can go ahead and discard of all your other supplies and go ahead and wash your hands, and that's basically all there is to the skill. After you've had the bag on and you started to use it, you want to make sure that you're emptying out the bag when it's about a third full, so that way any of the solid feces that's in it or gas isn't going to cause the bag to pop or leak out, odorous gas or anything like that. And you want to change the entire appliance every 3 to 7 days. Oh, okay. That doesn't seem that bad. I think I can manage that. All right, well, why don't we go ahead and I'm going to have you kind of teach me back what you've learned and go ahead and demonstrate this back to me, okay? Okay, let's go ahead and do this. All right, so I got my washcloth, got my adhesive, my bag, and then my scissors. Okay, cool. So what are you going to go ahead and do first then? I'm going to go ahead and wash my hands, and then I'd put on my gloves. Next, I'm going to get my towels and stuff, and I'm going to go ahead and wash the stoma area. So I'm going to go ahead and wash around, and then pat dry, and then you want to wash the actual stoma, and then pat dry till it's completely dry. Okay, good. What is going to be your next step before you actually put the adhesive on? Next, I'm going to measure the stoma and look for any abnormalities. So if it's like really dark or if it's really pale, that could be signs of anemia or a poor blood supply. And then I'm going to go ahead and get it measured out and then go ahead and cut the hole in my adhesive. All right, so I went ahead and I measured it out. I got my hole cut. And then I'm going to go ahead and make sure this bag is clamped. And then I'm going to go ahead and attach the bag to my adhesive. And then I'm going to take this back part off so it'll attach. And then I'm going to go ahead and put the adhesive over my stoma. And I'm going to make sure that it's properly sealed on there. And then I'm going to tug it, make sure the bag's on. And it looks like it's on okay, and it doesn't look like the seal's broken. There's no wrinkles or anything. And so I think it's on okay now. After I'm done with that, I'll go ahead and wash my hands and then throw away my gloves. Okay, that looks pretty good. I don't think you did anything wrong, and it looks like you got it on there pretty good. So okay, cool. I think I'm definitely ready to start doing this for myself. All right. Well, do you have any questions for me or anything? Not that I can think of. Thank you for helping me to learn this, though. Oh, okay. Just make sure that if there's any excessive bleeding that's going on at the stoma, that you're going to let your healthcare provider know, and also let him know if you have any other serious skin breakdown or signs of anemia or lack of blood flow in the stoma as well.